In this video, we will look at the use of ultrasound in pregnancy, the timing of the scans, and what additional scans might be needed during pregnancy. An ultrasound scan is an easy way to look at the developing baby inside a pregnant woman's uterus. The image can be enlarged to view the uterus, the placenta, the amniotic fluid, and the overall structure of the baby. Ultrasound scans have been performed in pregnancy for more than 30 years. Until now, there are no known risks for mothers or fetus. Sound waves can generate heat as they cause small vibrations. This heat is minimal and dissipates quickly, but can build up if the scan is performed over a long period of time in the same area. Therefore, it is important that the professional performing the ultrasound keeps that in mind while performing the examination. There are international safety regulations to which all companies making ultrasound equipment have to comply. There are two types of scans which may be offered to pregnant women: the external scan and the internal scan. Also known as the transabdominal scan, a small amount of ultrasound jelly is applied over the abdomen. The jelly ensures contact between the woman and the probe and improves the quality of the images. Sometimes the woman may be asked to have a comfortably full bladder, such as when checking for nuchal translucency. This helps improve the images obtained, which can be hard to interpret when the bladder is empty. An internal ultrasound scan is also known as a transvaginal scan, which is usually performed in early pregnancy. It requires removal of the underwear and any sanitary wear. The probe used is always covered by a clean cover. Ultrasound jelly is squirted into the cover and also applied to the end of the probe to improve the contact for better imaging, as with the external transabdominal scanning. The transvaginal scan involves the insertion of a relatively thin probe into the vagina. While the probe is relatively long, only the very end is inserted. The length of the probe is simply to allow the person performing the scan to move it during the examination. In contrast to the transabdominal scan, an empty bladder is required. The patient will likely be asked to empty her bladder before the scan starts. Ultrasound scans during pregnancy are an important part of pregnancy care. In the past, doctors relied on external or internal physical examinations only. While this is still important, scans can provide much more information. Moreover, it is the only way of seeing the baby. Sometimes the physical examination may suggest a problem. For example, the abdomen feels too small or too big for the week of pregnancy. Ultrasound can provide more information on the growth of the baby and the amount of water that surrounds him or her. Scans may be performed at various times in pregnancy with different aims. The number of scans will vary according to where the pregnant lady is having the scan and whether any problems are suspected. A variety of questions can be answered by these routine scans. Scans in early pregnancies up to 10 weeks will show the following: if the pregnancy is in the uterus, number of babies. If twins, what kind of twins are they? Heartbeat of the baby. And estimated due date. For pregnancies from 11 to 14 weeks, these questions can be answered. Is the baby's early development appearing normal? How many babies are there? If twins, what kind of twins are they? Are there any anomalies visible? Is there extra fluid in the neck? When is the due date? During this scan, pregnant women may be offered the option to have a risk assessment for chromosomal anomalies such as Down syndrome. For pregnancies from 20 weeks onwards, scans can show if the baby is growing well, whether there are structural problems detected in the baby, location of the placenta in the uterus, and if there is a normal amount of water around the baby. When the pregnancy reaches its last trimester, it can answer the following questions. Is the baby growing well? Is there a normal amount of water around the baby? What is the baby's position? Are there problems suspected that could not be seen earlier? The ultrasound machine can also be used to examine the flow of blood to the placenta or within certain blood vessels. Color Doppler may be used to identify the vessels that will show in red or blue colors according to the direction of blood flow. Blood flow produces a unique sound which resembles the heartbeat. This examination can add important information on how well the placenta is working and on the condition of the fetus. If during the scan any suspicious finding is seen, a specialist may be brought in. If the area of concern is specific, such as the heart, a fetal cardiologist may be brought in, and the scan may be repeated in more detail to look for the condition that is suspected. Further tests may be suggested. Expectant mothers may need to wait for results of these tests, but should be told when to expect them and how they will be informed. They may feel anxious during this time, and the doctor or midwife should recommend someone for them to talk to if they wish. Many ultrasound machines are currently able to produce 3D pictures. These pictures can be useful to add some details when anomalies are suspected. The person performing the scan will decide if a 3D scan is necessary. The cervical length measurement is performed using a small probe inserted into the vagina with the purpose of measuring the length of the cervix. If the cervix is short, the doctor or midwife will discuss whether there is an increased chance of premature birth and possible measures to prevent it. Is the pregnancy scan compulsory? No, the scan is up to the woman's choice. However, ultrasound is the only technique that allows the possibility to look at the fetus. The information gathered is important for good pregnancy care, and most doctors consider the scan a key part of this. It is also important that the purpose of the scan is explained so that the pregnant women are not confronted with unwanted information. Ultrasound is not perfect, and it can miss problems or incorrectly classify them. Further tests or a repeat scan may be required to confirm the findings. It is not unusual for an ultrasound scan to suggest one problem and for another to be found after the baby is born. In conclusion, a fetal ultrasound offers reassurance that a baby is growing and developing normally. This is also a way for healthcare providers to get more details about the fetus health so that additional tests may be recommended if necessary. Thank you for watching this video. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynaecology. For more videos like this, head on to the National University of Singapore's website.